Our next speaker, Jane Stevens, will discuss what ACE's initiatives are doing to respond to COVID-19. Jane is the founder and publisher of ACE's Connection. ACE's Connection educates and supports more than 47,000 members and more than 300 ACE's initiatives as they integrate the science of ACEs into their work. Jane?
Hi, thank you for the introduction and for inviting me. I'm really honored to be included in this discussion today. The two outstanding events of 2020 so far are the pandemic that exposed the great chasms in our social, political, and economic structures, and the awakening that finally took hold as a result of the tragedies that spurred the Black Lives Matter movement. As tragedies on this scale often do, they are providing an unexpected and remarkable opportunity. In the spring, when we heard people saying, "I wish things would get back to normal," we said, we don't want things to go back to normal. Normal wasn't such a great place for most people in this country. We said, we're going to work with a lot of like-minded folks to create a better normal. The science of adverse childhood experiences is at the foundation of all that we do. And I should just quickly explain what we mean by ACEs science, and it's these 5 parts: measuring the burden of childhood adversity on individuals, organizations, systems, and communities, the impact of toxic stress from ACEs on the brain, how toxic stress from ACEs damages our health, how it's passed on from generation to generation and in systems through decades, and how the brain and body can heal and how we can prevent ACEs. This relatively new understanding of human development and why humans behave the way they do is central to addressing solutions. And the solutions are counterintuitive. If you focus less on the individual ACE and more on the healing of the whole person, the whole organization, the whole community, there's a better chance at achieving solutions. And I'll provide some examples later. There we go. Had to wait for that. The reason I'm showing this slide is because I want to emphasize that ACEs are so much more than the original 10 ACEs in the CDC Kaiser Permanente study, and so intertwined with cascading effects. COVID-19 is just one of a number of ACEs that children are dealing with now, as Jack mentioned, and the best approach to protecting them is to protect us, their parents, the organizations and systems that care for them, the organizations and systems their parents work in, and the communities they live in. The slide is having a little bit of trouble coming up. There we go. So this is what we do. This isn't just an issue of solving or dealing with a pandemic. This pandemic will be solved in 2 or 3 years. The pandemic has offered us a remarkable opportunity to use ACEs science to lay a foundation to take a truly evolutionary and revolutionary approach to solving most of our other ACEs. And that, in the long run, will help humans cope with the greatest challenge to humanity that's coming up, climate change and its effects. So here's a little information about us and what we do. ACEs Connection is a social journalism network. At present, we have more than 47,000 members it's not accurate on this slide, but we do. All people who are integrating ACEs science and into their lives, their organizations, systems, and communities. I need to go back one. There we go. The people and communities who participate in ACES Connection, and this is all free, by the way, supported by some wonderful donors, such as the Robert Wood Johnson Foundation and the California Endowment. Anyway, they learn about these new practices and policies and use them in their own organizations and communities. When they make improvements, they share those with the rest of the ACES community to accelerate the use of this knowledge. Right now, we believe there are several hundred cross-sector initiatives in the U.S. We aim to have about 1,000 in our network in the next 2 years and 5,000 in the next 5 years. Sounds like a lot, but that's actually still a very small number. There are 34,000 cities and counties in the U.S., and every community will benefit greatly by incorporating this knowledge. We think that 5,000 is probably a tipping point, which is why we're aiming for that. We work in person, COVID willing, and online with ACES initiatives in cities, counties, states, and nations. We provide them tools such as Diversity, Equity, and Inclusion Tool and guidelines to launch and grow their ACES initiatives. For mature ACES initiatives, we recently launched a cooperative of communities with unique tools that quickly measure a community's progress in becoming trauma-informed, as well as correlate their progress with outcome data organized by sectors in their community. The cooperative also provides services such as learning collaboratives, network leadership training, and ACES-informed diversity, equity, and inclusion training for initiatives. If you want more information about that, you feel free to contact me later. So we send out a daily digest and weekly roundup of the latest ACES science, trauma-informed and resilience-building news, research, and reports. We get a lot of information from Jack Shonkoff's organization. The Resources Center has surveys, resilience surveys, ACES science presentations, download, much more. We have an Ask the Community on our network so that people can help each other to find information. Our reporters post articles about the use of ACES science, and many get wide distribution. The article about Dr. Dan Sumrock and the addiction article on there has had nearly 2 million page views, and it led him and others in the article to testify before Congress. The articles do more than that, though. They show what's possible, and it leads many other people to integrate ACES science into their organizations. For example, we reported how schools use ACES science to eliminate suspensions and expulsions, with a result in many communities that the school-to-prison pipeline is being shut down. And kids are happier, enthusiastic about learning, and get better grades. In the story about Dr. Sumrock, data and he and others at the University of Tennessee gathered showed that 100% of patients were no longer addicted and could hold down jobs. They're also able to predict relapse and how a long-term course of treatment reduces relapse. Batterer intervention programs that integrate ACES science reduce recidivism from 30 to 60% to just 1%. Safe Babies courts that integrate ACES science show that 1 year after participating, 99% of the kids suffer no further abuse. It just goes on, and I can provide many other examples. There we go. Since the pandemic began, we've pivoted in a number of ways. We write articles such as how trauma-informed pediatric clinics are grappling with telehealth, how the pandemic has revealed system inequities. For example, in this story, we mentioned that when Sacramento County in California received CARES Act funding, 85% or more than $100 million went to law enforcement and only 2% or $2.5 million to public health. We'd like to see that changed. Since March, we've been doing 2 or 3 community conversations a week on topics requested by our members. These include topics about child care, domestic violence, and trauma-informed policing. The demand for addressing issues in education is so popular that the Education Better Normal meets every Thursday, and it attracts up to 100 people from around the world. We limit it to 100 because we want to actually have a conversation. Each Better Normal addresses how to deal with a pandemic and how to shift for long-term change. We're hosting our 50th Better Normal on Tuesday. We provide resources that we continually cull and update for educators, parents, and healthcare providers. We do articles in Better Normals about what communities are doing to address the pandemic in the short term, as well as how they're integrating changes over the next several years. So this is a quote from Quinn Zora. She's a public health nurse who was a pioneer in integrating ACEs. And she said, this is the introduction to Near at Home, an ACEs module that 60 public health experts put together for a home visiting community. If this knowledge about ACEs science is integrated into individuals, organizations across sectors, in systems and communities, we will create a better world for our kids, no doubt. And we definitely want to equip them with all the resilience they'll need to figure out a way to thrive during the upcoming climate change. Humans' historical approach to changing people's behavior, whether it's criminal, unhealthy, or unwanted behavior, is to use blame, shame, and punishment, or to throw a cacophony of information at them and expect them to change. Instead of using blame, shame, and punishment, how do we restructure organizations to understand, nurture, and help people heal themselves? And you do that by educating them about ACEs science and then show them how to integrate it. Only that way can we create communities that manage problems and change them to those that manage solutions. Understanding this new knowledge about ACEs science can be life-changing. It starts with a mind shift. That's because when we learn about ACEs science, we understand 4 essential aspects about ourselves: that we weren't born bad, we weren't responsible for the things that happened to us when we were children, we coped appropriately given that we were offered no healthy ways to cope, and it kept us alive. And the 4th one is that we can change. Now this applies to organizations too, the same kind of approach. And integrating sciences into an organization is complicated, it's ongoing for years, and it's extremely rewarding. But it's not just another program. Organizations must integrate this into their own workforces before they can expect to be able to integrate it into their practices and policies for their clients, students, patients, and prisoners. Basically, thanks to pioneers like Jack, we know how to create a much better normal. And by using ACE's science lens, we can take advantage of a pandemic that has laid bare the great chasms of structural inequities in this country and in the world. We can solve our most intractable problems so that we create organizations that manage solutions in context of the whole instead of playing whack-a-mole by trying to solve problems individually. And I have some resources that will be included in the PowerPoint that you all will receive. Thank you so much. I really appreciate being here.